I'm Gloria Strode and welcome to Straightforward. Today we're going to educate you on taking care of your kidneys and treatment of kidney disease. And my great friend and sponsor, Dr. Chauhan, is here. Welcome.
Thank you for inviting us.
It's been a long time since you were here. You
That's
were last
correct.
here with Dr. Tamori Smith, who's one of your partners, and you all are so busy all over the state, 2 states actually, over in Alabama and Georgia, taking care of people.
That's correct.
So today we wanted to share with our audience some of the options should they find themselves with kidney disease. But first you're going to educate us on what all of that is and what we have going on with the latest technology.
So as you know, the dialysis has been very well known to the community. Once you have a kidney failure, when recovery is not possible, then you need a renal replacement therapy. And those circumstances, we have 2 or 3 options. The transplant is the best option. If you can get transplant without getting dialysis, is the best option. But if you're not able to get transplant, then you have to think about other options, which is the regular hemodialysis, which you go in center and get dialysis. Other option is doing PD, which is at home dialysis, where you're not using blood as a mean and you use a sugar solution for dialysis purposes and you use your belly for dialysis. And third one is home hemodialysis, that you do a smaller machine and use hemodialysis using your own blood and can be dialyzed at home at your own convenience. So that's what there are 3 different options are, and primarily we're going to talk about home dialysis, the both option, PD as well as home hemodialysis.
So we've really come a long way for those that suffer with kidney disease. Of course, you know, my dad had it, and you all did an excellent job of taking care of him. But the technology is so advanced now, where we've had people to go into the dialysis centers. They can actually do it at home.
That's correct.
And it's just as successful.
As good as, and it's even better.
Really?
Yeah, outcomes are shown that when you do home dialysis modality, your outcome is better, your mortality is reduced, and your quality of life is much better than regular going in center dialysis.
Okay, is that because you're doing it in the comfort of your home? It's less stressful with getting dressed, going to a facility. You can kind of work your in-home schedule.
That's one big factor, that you could be as productive as you were before dialysis. You can go to the workforce. It doesn't limit you not to go to the work Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday according to your dialysis schedule.
Right.
You go to work, you come back home, and then do dialysis as your prescription allows you. And most of the people do in the evening time, which doesn't interfere with their work schedule. And also, they can do according to their needs. It doesn't affect the weather because they're at home.
Exactly, because when it's raining, and I remember this from my dad, whether it's raining, snowing, if it's 185, you still have to get in the car and go for dialysis.
That's the beauty about home dialysis, that it gives you a convenience of at home and doing your way how you can do it better.
So, our insurance companies, do they cover this? Do they recommend this? Is it more cost effective?
It's very, very cost effective. First of all, the belly dialysis, which we call the peritoneal dialysis, all the insurance companies prefer doing belly dialysis.
Oh, really?
Even Medicare gives them an insurance day 1.
Really?
When you initiate the peritoneal dialysis.
Because it's a savings.
Saving. And the mortality benefit is shown in peritoneal dialysis also. And they continue to produce urine. So they are not dependent on dialysis alone. Their kidney function, whatever they start with, they can maintain a preservation of renal function, even doing with peritoneal dialysis.
Well, I was a little afraid of that with my father because I thought I was going to make a mistake. And I have other siblings, and I didn't want to own that. But, of course, Mr. Richardson is a subject matter expert, and he's going to be sharing with us his experience with that. But, Mr. Richardson, thank you so much for coming today and being willing to share your experience.
Well, thank you for putting this out there. I mean, it's a great experience. It is.
Well, thank you so much. But you originally started with in-center. You went to a facility for dialysis?
Yes, I did. I went to the in-center for probably a year.
Really?
Yeah, yes, ma'am. And the biggest thing was I wanted to continue to work. And I wanted a different type of modality so I could go to work. And then was recommended to me by Dr. Chauhan to do peritoneal dialysis. And it was
Was it frightening? Did you trust yourself at first? Because I know you've been into the center and you've watched it, so you kind of knew what the routine was, but you didn't second guess yourself.
No, well, no, ma'am. The reason why I really, they really prepare you for it. Where you do 6 weeks of training.
Okay.
And prior to your training, you have to do a type of modality where you don't use the machine, but you have to you drain yourself with gravity. And you do that for like four weeks just to get your tubes and make sure that your tube is functioning properly.
Really?
And once you've done that, yes ma'am, once you've done that, you start on the machine.
So you kind of had an on-the-job training kind of thing, and they
Yes,
make
ma'am.
sure that you're ready.
Yeah,
so
yes,
it's
ma'am.
not like some quick fix. It's like we're going to train you, we're going to watch you, then we're going to make sure you know how to handle this.
Yes ma'am, that's
Okay.
exactly what they do. And,
All right.
And the nurses and the doctors have been tremendous.
And so it has allowed you to continue with your work schedule and some of the other good quality of life things.
Exactly, ma'am.
Right.
Well, my wife and I, we have a shared time. I share a shareholder down in Hilton Head, and it allowed us to take that with us, this machine with us.
Really?
And do, yes, ma'am, and do.
So
my
you can go
dialysis
to
daily.
your resort where you have time sharing
Yeah,
and
time
take
sharing,
this
yes,
with
ma'am.
you.
Yes, ma'am.
Really?
Yes, ma'am.
And so even though it's not in your home, you still feel comfortable enough
Very
that you
comfortable.
have all the tools to take care of
As
it.
long as I follow the directions that were given to me, make sure I don't get infected, I have no problem.
So they are teaching you everything about making sure you're germ-free and just everything
Yes,
from
ma'am.
beginning to the
To
end.
beginning to end.
Wow, isn't that something? So when you first started your career, we didn't have all of this, did we?
We had it, but it was underutilized.
Okay.
It was, the services were there, but it was never being that progressive. Patient didn't want to take the modality at home. And now as people are aware of and people want to work, continue to be productive, continue to be close to the family, continue to have vacation time, they
Yeah.
start using this modality much more easier, and the mortality benefits are being shown over the period of time. People live 3 years longer on this
Really?
dialysis as compared to conventional hemodialysis.
Okay, so it's the extension of the life.
That's correct.
Well, what we're going to do is go to our sponsors and then we'll be right back. Okay, we'll be right back after word from some of our sponsors. Straightforward is brought to you by Chalk by Quincy introduces Excellence Redefined, timepieces of the finest technology, luxury, and class with tons of style at chalklifestyle.com. Renal Associates, LLC, a team of physicians dedicated to excellent kidney care with 5 convenient locations to serve you. Stark Avenue, Columbus, Bradley Park, Columbus, Lafayette Parkway, LaGrange, East Burkhalter Avenue, Buena Vista, and Springs Street in Warm Springs. The Framing Factory and Art Gallery, specializing in quality art and framing for all your needs. Original etchings, limited editions, and prints. Call Carlton Dickey today at 706-324-3823 or visit the Art Gallery at 1325 17th Street in Columbus.
Walmart's reason for supporting Thurgood Marshall College Fund is simple. We like to win. And we have been given a lot of exposure to some incredible talent. And we also believe that it's a part of our responsibility to the community to give back. This is a great opportunity to do both. It's been a wonderful experience for us through the years. We've appreciated our partnership. We believe in return on investment, and we have definitely had a remarkable return.
Come meet your new best friend at Paws Humane.
Adopting from your shelter makes sense. You get a great friend checked by our vet. They're fixed, all shots, microchipped, all ready to make you and your family's life better. 4900 Milton Road, Columbus. Paws Humane.
Come meet your new best friend at Paws Humane.
Welcome back to Straightforward. We're continuing to educate you because we want you to have great health And my awesome friend and sponsor, Dr. Chauhan, has come today and brought Mr. Richardson. And the story is just, I mean, I'm impressed. For those that have had family members like myself, we've seen people over the years go through dialysis. You look fabulous. And now you've just educated me on how you can go on vacation and take that and still hang on the beach and go back to your residence and take care of business and go back to the beach and eat seafood and all of that.
Yes, ma'am.
That is really outstanding.
That's correct.
Yeah. So what are we want to encourage more families. What I found was when my dad had it Tuesday, Thursday, and Saturday, everything, that was like the Bible. You had to do everything around Tuesday, Thursday, Saturday. Even if there was a family reunion, you couldn't do that unless you went to have the dialysis. And they would let you move the days if it was bad weather or something like that. But with this is why you're trying to educate the community on this.
Yeah, that's why it gives you a lot more freedom in real sense, like how you can live daily life without thinking about dialysis around it. You just, dialysis is a part of life, but it's not around your life.
It's not your life.
Your life.
It should
You
just be a
have-
portion
yeah,
of your
portion
life.
of your life. You can deal with it in the evening time or night time, whenever you're comfortable with, and you can have a routine, like your work, your travel, your church, whatever you want to do, you can do it. Your volunteer work.
Okay,
It should
so
not stop you.
So we're not buying this. We get to use this based on the service provider.
That's correct.
And who's maintaining it? Do they check it periodically to make sure everything is gauged? And
Yes, every month you will do a test. You have a disc that goes inside of it, inside this box right
a
here.
disc.
Yes,
So
ma'am.
like a computer disc.
Computer
This
disc,
is computer.
It's a little small disc.
Okay.
And every month it goes to the back to the center where that's your home center, and they pull the information off of it, make sure it's working properly, make sure that you're doing dialysis properly, and then you just and once you download the disc, she gives it back to you, take it back home, and you start again.
So that's kind of like your report card.
Exactly. That's exactly
So if
what
the
it is.
numbers are not quite right, then they know we need to make some
Yes,
adjustments.
exactly.
Oh,
Yes, ma'am.
really?
Yes, ma'am.
Wow, that is so impressive. So even in the rural communities, and I'm concerned about that because oftentimes in the rural, they don't have access to a lot of the things we have in the urban areas. Is this something that your patients, because I know you all go all the way out to Montezuma and over into Alabama, do they have this option or it's just people in the metro area?
This is the beauty about the remote dialysis. This is the people, those who cannot access to the urban community, those who don't have access to the big dialysis units. This is the best dialysis you can do at home. You don't have to travel back and forth. In the old days, people used to travel 100 miles to get dialysis.
Yes.
Nowadays, it's 40 miles, sometimes 30 miles. But this is 3 times a week, you have to travel 30 to 40 miles. It's not practical for your life. You have to find something which can be done at home. And it can be done very easily, and if you follow the rules, the infection risk is very minimum. The support system is very good because everybody has landline and cell phones. There is always 24-hour support line.
Okay, so there is like the
Yes.
Ask a Nurse back in the day.
Yes,
If
exactly.
you run into a problem, you can call up and someone's there to troubleshoot it for
Exactly.
you. Okay.
And the service is very. These guys are just like they're looking at the machine with you.
Really?
You tell them the problem, and they can talk you through it to the end.
Really?
And they're still on the phone with you until you work it
Until you
properly.
get it and that
Yes,
you're
ma'am.
comfortable with it.
Yes.
So the people out in the rural, as long as they have, this is electric, right? You have-
Electric.
as long as they have electricity and a phone, then they're good to go. And then they just come in that once a month and bring in that little report card you were telling me about that they download the data from.
Yes, yes.
And then it's just, so that's a once a month versus
Once a month what?
3 times a week.
Oh,
Exactly.
once a month.
Really?
Yeah.
God, this is really phenomenal.
It gives you a lot of freedom. You don't have to gear your life toward dialysis. You can live your life the way you want to live.
Right, and we're in the football season.
Oh, yeah.
So when you get ready to go to the Super Bowl, you're just going to pack that up in the car and it's ready to go.
Yes, ma'am.
So besides this piece, do we have it's a lot of other chemicals that come with this? Do they have to be refrigerated? What
No,
happens
ma'am.
with
Well,
that?
you get depending on the amount of dialysis you have to do, you receive these bags of, like I say, sugar liquid oil. And
That's a sugar solution?
It's already mixed for you. All you
Oh,
have
it's
to-
pre-mixed,
yeah, yes,
so
ma'am.
it doesn't require any measurements or anything like that?
And
Okay.
you hook up to you hook it to the machine, and the machine does everything. Matter of fact, I would do mine at night, and I would go to sleep and just wake up the next morning and hook myself.
Oh, so you can do it while you're asleep.
Yeah.
You don't have to watch it.
No.
Oh my goodness. Yeah, I think this is important that we get this out to people because, see, when we first started this conversation, I was thinking if it's working, you got to sit there and watch it.
No, ma'am.
But you don't. You can
once
just hook up, go to
you
sleep, and
wake up
it
the next
does what
morning.
it's supposed to do, and
Yes,
when it's
ma'am.
done, it shuts off.
And the great thing about this, a line comes with it.
Mm-hmm.
So that line, I think it's about 40 to 50 feet.
Mm-hmm.
It allows you to move around inside your room. If you need to go to the bathroom, you can go to the bathroom.
Really?
Yeah, yes, ma'am. So,
Yeah, if you need to go to the kitchen and do something, and you can
ma'am.
do all of that. Oh my goodness. So this is really liberating. That's
Very
what we
much.
should be saying.
Yeah,
This is really
it is
liberating. Yeah.
Yes, ma'am.
Right. So you would recommend this to anyone
Yes, ma'am. I would recommend this.
because you've had both. You've had in-center and then you've had this.
I've had three. I have in-center, this, and I've also, presently I'm doing the HHD, which is home hemodialysis.
So you are the walking expert.
I wouldn't call myself an expert, but I call
Well, I mean,
call
you-
He's a living expert.
Yeah,
I
really.
would call
Living on the
myself a-
modality.
Yeah, you are a living expert. Yeah, and I think, when we have our professionals share something with us, we are always kind of a little iffy. But for you, you have, like Dr. Chauhan said, you're a living expert.
Yes, ma'am.
So you have experienced it, and you can share with others to help them to be more comfortable.
Yes, and that's one thing I'm trying to do is when I see anybody that's on dialysis. As a matter of fact, there's a guy that's that works with me.
Mm-hmm.
He decided to do home hemo based on what I told him.
Right.
Even though he doesn't go to this doctor, he goes
Right.
to a doctor, but he chose home hemo based on that. So.
Based on that, because you were walking testimony. But before you were on dialysis, you had, when I first met you at another event, you had a family member that was
Yes.
on dialysis before you.
Yes, my father was on dialysis for 15 years, and all I knew.
15 years.
Yes, ma'am. And all I knew about dialysis was going into the center,
Right.
coming home, being drained and that. But one time I got assigned to Dr. Chauhan.
Mm-hmm.
They gave me the different modalities, and I tried.
So you had watched your
Yes,
father
first.
for 15 years go to the
Yes.
center 3
Yes.
times a week.
Yes, ma'am.
And it's usually about 3 hours. Folks are on that machine.
3 to 4 hours.
3 to
depending
4
on the
hours.
volume, yeah.
Right. And so you had that knowledge before you needed dialysis.
Yes.
So it was kind of more of a hereditary genetic kind of thing.
Yes, yes.
Yeah. And so that's important. We want to educate people on that as well. Well, what we're going to do is go to our sponsors, to our final break, and we'll be right back.
Yes, ma'am.
We'll be right back after word from some of our sponsors. Straightforward is brought to you by Warrior Outreach. Contact Command Sergeant Major Retired Sam Rhodes or Kathy Rhodes. Freedom Printing for all of your designer printing needs. Gunboat Plaza, Suite 18. Thai Cuisine, the area's only authentic Thai restaurant. Open for lunch and dinner, Monday through Saturday. Located in the Village Green Shopping Center on the 280 bypass in Phoenix City. Progressive Funeral Home, family owned and operated since 1952. The George Ford legacy of high standards continues today in the compassionate and professional services provided. A touch of dignity for those who care. Progressive Funeral Home, 4235 St. Mary's Road, trusted by generations. Best Care, transforming minds and bodies, leading the way in the latest techniques of medical weight loss and wellness. Certified in family medicine and bariatrics, Dr. Blunt is ready to assist in the transformation of your mind and body. Call today, 706-221-6477, or visit bestcarecolumbus.com. East Alabama Endocrinology, educating and caring for those living with diabetes in Alabama and Georgia. 1400 Bradley Lake Boulevard, 3320 Skyway Drive, Suite 602, Opelika. Take charge of diabetes and live your best life. Vanessa Jackson's District 3 Successful Scholars Program, supporting students in achieving academic excellence, outstanding citizenship, positive social and cultural growth. believing in success for kids. And welcome back to Straightforward. We are continuing to educate you on a very important matter. We have talked a little about kidney disease and some of the options that you have instead of going to the center 3 times a week. So, Mr. Richardson, you are the walking testimony. You are the living example of how successful all of these different options are. So this one is a little different than the first one.
Yes, ma'am.
Okay, so what's the difference between this one?
But this one uses blood. It's just like a little smaller version of the machine they use inside the center.
Really?
But it's available for you to take home and use at home. It weighs about 70 pounds. But the same thing, you can pack this up and you can go on vacation, family reunions, whatever you want to do.
So Dr. Chauhan, this one, because it deals with, this was the one that deals with the blood. So you have to have a partner with this one.
That's the ideal situation. If you have a partner, that could be the best option. We have some patients without partners have done the home hemodialysis. And this dialysis is traditionally 4 to 5 times a week, depending on 6 times a week. But it's a short run dialysis. And this is the ideal dialysis in the best way possible.
Really?
Because it cleans your blood very clean, but short run, you don't feel tired after dialysis.
Okay.
And your blood is as clean as possible in the requirement of blood pressure medicine. Phosphorus binders goes down tremendously with this dialysis. And it has also shown a significant improvement in mortality as well.
Really?
But this dialysis require, most of the time, you have to have a partner or some family member or anybody from the community who's ready to help you.
Right, it could be
They
your
can help
neighbor.
you. It could be neighbor, and that's, we have many examples that your neighbors have done treatments for you. Your church members have helped you to set up a machine and do dialysis, because it's short run. Usually you do in the evening time. Multiple people can be trained and can be done.
So when we say short run, the other method is a longer process.
That's correct.
When we say short run, what are we saying? Is this 30, 45, or an hour?
No, it's like 1.5 to 2 hour treatment time.
Okay, unlike the 3 to 4 hours.
3 to 4 hours.
Okay.
And sometimes for the people, those who are a little larger volume or larger sizes, they require 5 hours of dialysis. For this one, and traditionally it requires 2 hours time frame, and then it can be multiple sessions, but only short run. On
and again, this is something that the insurance company will approve.
They will. They will approve because they have shown the benefit on the patient's life, and hence they has been approved by the insurance companies as well.
Okay, so Mr. Richardson is our subject matter expert as a living patient, and you've experienced these. So this one you have used and traveled with this one as well.
Yes, ma'am, I have. This one right here, like I said, it involves blood, but the good thing about it is, like he said, it's shorter times. But mine is a little longer. I do mine about 4 hours a night, but I do less days. And the reason why.
So you come up with your own formula.
Well,
See, that's
no,
what happens when you're a subject matter expert. You know
I-
what works best for you.
Yes, ma'am,
So
that's
you're
it.
doing fewer days, but a longer
longer
session.
Yes, ma'am.
Okay, and so that came from over time as you got more comfortable.
Well, this when I first started out, it came out at 3 hours, 5 days a week, and then when I took it home,
Right.
The nurse called me and said, I need you to try to come up with a time that will make it better for you. And what I did was 4 days a week, 4 hours a night, 4 hours and 4.5 hours.
Really?
Yes,
And so because this is different from the other one, this one involves blood, how did this work for your family, your wife, and were you all afraid? Was she afraid at first, or?
Initially, she was afraid. When I first decided to try the home hemo, I asked my wife, were they going to stick me?
Right.
I need to be stick.
Right.
Do you think you can do it?
Yeah, because you know what? You have to have nerve to do that.
Yeah.
I'm one that can't stand blood tests, so I probably wouldn't do well with this, but you had to get her on board.
And like the champion she is,
Yes.
she did say, whatever needs to be done for
We
you
can
to
do
do
this.
Dialysis, yes.
Absolutely.
So we went for maybe 6 weeks of training, 6 weeks of training to learn how to set the machine up, learn all the parts that go with it as far as the solutions that come with it.
And those are already pre-measured?
Yes, already
Okay.
pre-measured. And at 6 weeks, she
She's an expert
did her
now.
first stick. Did her first stick.
So she's brave now. She's an old pro at it now.
But you know, initially it was when we first went home. Initially, it was I lost some blood. But now she's the expert. Yes,
Yeah.
she is.
So Dr. Chauhan, are we using more of this one or the other one as we're educating people? Because you know, some of us are fearful of the blood. So do you have more people using the other one than this one? And this is something you want them to graduate to. Should I
Yeah,
say
the
that?
experience is that it's much easier, the PD, peritoneal dialysis, is much more easier to do it. There's no blood involved, and there's no partnership involved. There's no partner is per se required as for the home modality. So majority of people will choose that one. But there are patients who chooses home hemodialysis because of shorter run. You don't have to do every night.
Right.
PD you have to do every night. Here you can do 5 to 6 nights. You can get exceptional results on this one. And some people choose this, and some people don't want a catheter in the belly. They want to do conventional hemodialysis, but at home. So it provides you both luxury being home, mortality benefit, you feel good, flexibility in your lifestyle, and you continue to be productive as a productive citizen in the society.
So this is why you have Mr. Richardson on the circuit with you. And of course, here at Straightforward, we always want to educate all of our viewers on all the issues, health and community issues as well. But I think because of your success, it's important that you're out in the community more.
Yes, ma'am.
Because we always fear the things we don't understand, but you have been on both sides.
Yes, ma'am.
First, you saw it as a child for your father, then you became a patient, and then you've had all of the different processes.
Yes.
So, and what's your testimony to that?
Well, my thing is, if you want to still be a productive citizen and work and go out on vacation and be able to go when you want to go, I recommend home hemodialysis. It's like I said, the benefits have been great for me. It allows me and because it's just me and my wife now. It allows my wife and I to travel, to go out and don't have to wait to do dialysis to do everything.
And to see the world and just enjoy your life.
Yes, ma'am.
Absolutely. Well, I thank you, Dr. Chauhan, so much for your support. Mr. Richardson, I just applaud you, and we definitely have to get you out into the community so you can help others to help themselves.
Yes, ma'am.
Thank you so much.
Thank you.
Thank you.
This has been Straightforward. If you don't stand for something, you will fall for anything. Until next time, be blessed.